Hello, everyone. My name is Crystal Harrington, and I wanted to give a warm welcome to all of you attending our 20th annual Social Work Colloquium here at WSU. I'm so glad we all get to come together still in this virtual space and discuss real life topics that we're passionate about. After reflecting on what interests me and what has been the most impactful in the last year, it was a given that I wanted to present over crisis and disasters that we have seen in 2020 and what that means for social work, how we as a profession can help and make a difference. My class and I are about to enter a workforce still reeling from a global pandemic, and in the last year, we have all collectively witnessed record-breaking wildfires, ice and tropical storms, plagued communities all over the country. Millions of Americans have been affected, and it is without question that these disasters are devastating for low-income communities, and particularly for Black, Latino, Indigenous, and immigrant households. We know that there were already systemic inequities in our society, and the pandemic and other crises just made this even more apparent. The graphs you can see were created this past March and were taken from the Department of Labor and Census Bureau's Household Pulse and Population Surveys launched in April 2020. This data highlights how the unprecedented health and economic crisis is affecting the nation. As you can see, Black and Latino adults were more than twice as likely as white adults to report that their household did not get enough to eat at 20% compared to 7% of white adults. And Latinos and other multiracial groups were not far behind at 19 and 18%. The second graph also indicates that millions are having difficulty paying rent. Here too, out of 12.1 million, renters of color and multiracial groups were more likely to report that their household was not caught up on rent, ranging from 20 to 24% compared to 12% of white renters. Also, it's important to include that social workers are seeing a distinct increase in mental health concerns, with adults reporting symptoms of anxiety and depression disorders at 41% in 2021 compared to 11% in June of 2019. Reducing extreme economic inequalities, as shown in the graphs, is one of the grand challenges of social work that we must continue to address. Because of social work's history in addressing injustice and reforming policy, our profession is uniquely positioned to take on this challenge and has critical roles to play in addressing it. In these times of need, social workers are the best equipped to help alleviate hardships for vulnerable populations before, during, and after acute crisis, and providing relief that is evidence-based and trauma-informed. To aid in creating a more equitable society during an economic and health crisis, we must look at past and current disaster relief practices and its implications for service delivery and advocacy in our political arena. It is evident and inspiring that during periods of major crisis, that policy changes happen. Massive and social interventions such as the Social Security Act and Works Project Administration were created during the era of the Great Depression. Social worker Francis Perkins actually headed FDR's Department of Justice during his presidency and had a huge influence on this policy work, which directly improved financial equity and unemployment for people in need at that time. The 15th anniversary of Hurricane Katrina on August 29th, nearly 7 months into the coronavirus pandemic, served as a painful reminder that both natural disasters and public health emergencies strike in uneven ways, with the heaviest toll falling on Black, Latin, Indigenous, and low-income communities. Many national, state, and local disaster recovery and resilience policies fail to adequately address the ongoing vulnerabilities experienced by low-income households. When extreme weather hits, families facing these conditions are driven deeper into economic distress. Analysis shows that housing assistance after extreme weather often favors middle-class households and homeowners. For example, in the aftermath, homeowners received aid based on the value of their homes instead of the cost of rehabilitation. Under this formula, higher income households that own higher valued homes were likely to receive more aid than lower income households who were often in greater need. Extreme weather further intensifies the housing and homelessness crisis in the United States, driving up rates of people experiencing homelessness, damaging the already limited stock of affordable housing, and causing rents to skyrocket due to sudden supply shocks. To address the disproportionate impacts, we must put on our advanced generalist lens that utilizes a systems theory framework. As practitioners, we understand that we are interacting with all systems within our roles and that all of the systems are simultaneously interacting and influencing one another. We can see that an event at one point in the system will have direct and rippling effects on the other parts. This can be seen especially during the pandemic, how it has impacted all levels of practice, from small individual systems, our schools, our communities, and economy and legislative action to provide aid. The basic premise for understanding and responding to crisis is that we must observe and analyze all of the dynamic systems that contribute to an individual's welfare and work to strengthen them. We empower our communities through disaster risk management, which includes a wide range of actions, whose primary aim is to reduce the vulnerability and impacts of disasters. These actions are commonly divided according to the steps of the disaster management cycle: prevention, preparedness, response, and recovery. We can also strengthen our systems by helping our elected officials and government agencies in strategic planning and cohesion before an emergency and designing policies that invest in communities and infrastructure in ways that intentionally and effectively address inequalities. We have the potential to bring a unique perspective to the disaster field by underscoring advanced generalist practice principles and our professional values of social justice, service, and empowerment to give attention to oppressed and disadvantaged populations and reduce the inequalities they are experiencing. We have an ethical responsibility to help people in need and address social problems through service while also challenging social injustice. This responsibility must advocate for social, political, and environmental equity and ensuring that all systems contribute to providing equal access and basic human needs. Again, utilizing our systems framework, if we can create changes on a macro level, it will directly benefit the range of services and access to resources available to individuals that we're assisting. Being mindful of disaster relief interventions that are immediate, geared towards mental health, and culturally competent are also very important, and I wish I had an hour in itself to discuss all of our values related to disaster relief, but what I'm stressing to you all is the call to be proactive and the social work implications for policy practice and social justice. Disasters, either natural or man-made, will continue to happen. We might not see a wildfire or tropical storm here in Kansas, but if we've learned anything from COVID-19, we need to use our knowledge and skills to increase preventative measures and try to lessen the blow for our communities. The impact and losses we've seen could be addressed and hopefully reduced with various solutions. A few that I would like to suggest that are rooted in the generalist practice framework would be to first infuse disaster management content and cases into the existing social work education curriculum. Currently, there is limited content in social work education with a specific focus on disaster management. We can absolutely utilize skills and theories that we use in everyday practice, such as crisis intervention theories, resource linking, needs assessments, providing support and post-disaster counseling. But future social workers must strengthen their knowledge of the impact of disasters and prepare for disaster relief responses such as psychological first aid, as well as ensuring proper intervention strategies are being used during the rescue phase that are most appropriate to the context of the disaster. When educators look at the CSWE competencies and how they are best preparing students to handle crisis or disasters that are going to continue to happen, we must incorporate a social justice and prevention-oriented framework to infuse disaster-related knowledge and skills into the social work education. Secondly, we must assist in coordinated comprehensive disaster planning and response from states and federal government. In order to address the impending threat of climate-fueled extreme weather and to ensure that the nation's most vulnerable communities have equal access to resources to protect themselves and rebuild after disasters, Congress and local agencies must immediately take action in implementing bold, equitable policies concerning housing and resilient community development and infrastructure. Most importantly, we can assist the coordination of numerous federal agencies and state and local governments to address underlying vulnerabilities and reduce the risk by bringing attention to historic injustice will be crucial. Communities that have faced disinvestment, redlining, and other forms of injustice will have infrastructure that is more vulnerable to hazards and needs additional support. It's important to note that right now, 10% of government subsidized housing is in floodplains, and we cannot let this continue to happen. Achieving effective disaster policies will not be simple. The work begins with social workers advocating for change and being a voice to put pressure on our government to make disaster reform a top priority. The previous administration had denied the science behind both COVID-19 and climate change, and in doing so had abdicated responsibility for the racial and class inequities that its policies have exacerbated in communities. Our government must act now to support these communities, which historically has been left behind time and time again. Through future economic stimulus and setting standards for disaster response and recovery packages, The state and local leaders can be advised to direct disaster rebuilding, funding, and creating climate change ready, affordable housing and infrastructure, especially in the most vulnerable areas. The crisis we've seen in 2020 did not just make systemic inequalities more apparent, but it has made our role as advocates and social justice warriors even more apparent. As a helping profession, we share a vital role in relief, recovery, and community resiliency. Coordination, reform, and consideration of social equity would be a good first step toward a safer, more resilient nation and would address a grand challenge of social work. If done right, modern disaster policy would endorse development that accounts for risk, promote climate-proof investments in infrastructure, advance social justice, and protect society's most vulnerable populations.